First of all, interstitial lung disease, what is it? It's basically a heterogeneous collection. It's like a kingdom and an umbrella of multiple diseases, about 100 or more distinct lung disorders that tend to be grouped together because they share clinical, radiologic, and pathologic features, all involving inflammation of the interstitium of the lung. Why do we care about it? Even though the incidence and prevalence generally in the United States is low, and I have down at the bottom, incidence a couple of years ago was 31,000 patients per year, prevalence about 90,000 patients in the US. In spite of those low numbers, most of them have high rates of morbidity and particularly mortality within years. They're commonly observed in patients across the entire age spectrum, but frequently the older adults. And most patients who are still working and have ILD, they're unable to work after a time, are breathless when they go upstairs or do any exertion, and they often have to leave their job to avoid exposure when exposure is one of the causes of their ILD. In this next slide, I've just shown sort of the a diagram of the lungs, and then looking from the bronchi to the bronchioles to the end organ, which is the alveolus. That's where the exchange from the pulmonary arteries, which are blue, they're not oxygenated yet. They interact with the alveolus to get oxygen, they become red. And the alveolus is like a ping pong ball or a bunch of blueberries in a plant. And they're covered by a network of blood vessels. If you now look closely at the margin, at the outer part of this ball, the ping pong ball, you're looking at here the alveolus on the inside, the wall of the alveolus, and here's the blood vessel that's surrounding it. The interstitium normally has some connective tissue, but oxygen that you inhale gets into the bloodstream, and as the blood goes by, the carbon dioxide from metabolism goes out. It's normally fairly thick, fairly fast, that's what I wanted to say. In the case of ILD lung disease, the interstitium, it's much thicker. It's scarred. It's thicker and scarred, so it's got distance and harder tissue to get through. So oxygen that you inhale has more trouble getting into the blood vessels on the red cells, and carbon dioxide from the red vessels go back into the lung more poorly. So that's the problem. As the blood flow increases, you're not oxygenating the blood, you're not getting oxygen to your tissue, you get fatigued and you feel miserable.